today we've decided to launch the Fertylink panel because we have really exciting news, and that is that the medications that couples...
Today's a special day. That's what we want to say. Today's a special day, and that's what we decided, okay, let's do that today.
Let's start doing this today because we have fantastic news and we want everybody to know. And again, we want this channel to be a place that you can count on getting good information. If you have questions, don't hesitate to write them below. But today, the announcement is that fertility drugs, everybody knows, our patients know fertility medications are expensive, and will my insurance cover that? And it's a problem that we face day in and day out of the fertility clinic is the cost. So one, if you don't have insurance, you pay for the cycle, and then on top of that, you're paying another, often $5,000 just for the medication. And on the clinic side, we're always working to get discounts for the patient and decrease the price, but we never are able to decrease the cost of the medications because that is controlled in an outside business, which is the pharmacy.
So this is a big deal. Let me just say a word. This is a big deal. So as everybody remembers, last year, as part of an initiative of the Trump administration on improved IVF access, we know, like everybody knows, the main hurdle for patients to access fertility care is financial. Access to medications, access to fertility centers is difficult because of the cost. So one of those issues are the medications. Medications are expensive. That's what it is. Medications are expensive. So here you can see the one publication of the American Society for Reproductive Medicine evaluating that initiative on IVF. You can see it here. And one of the parts of that initiative is medications. So here are the key details on IVF drug pricing. The pricing of the medication in fertility is just overwhelming. So let me just tell you here really quick. The preliminary information last year was that patients were about to save. There is a suggested potential savings of about $2,200 per cycle or per treatment, how the way call it, but we call it
IVF medications for the drugs that they use. But actually, the savings we think will be even more. And we just got word from the pharmacies today what the pricing will be for patients. You don't need to do anything. You're just going to switch over there. Yeah.
Perfect.
You don't need to show anything. You don't need to, based on your age or based on your income. All you need is to bring your prescription to these fertility pharmacies. And the new pricing for Gonal F will be 75 IUs, which in an IVF cycle, you probably need about 2,000 IUs. Really, truly. So I saw a patient today, actually, and I asked her, did you fill the Gonal F? And I said, what was ordered for her to the nurse? And the nurse told me that 300, it comes in a pen, and it has multiple doses in there. So they ordered a 300 for her. And I said, did your insurance cover it? She said, no. And I said, well, how much was it? And she said, $1,200, which is way outrageous for that amount of medication. Really, that medication should be about $300 with yesterday's pricing. And now moving forward, that price is going to be more like $150, $200 for that 300 IU pen. So it's a really significant savings for the women who do not have coverage. And so that woman did not get the medication because of the cost. And that's really unfortunate here in the United States, where we think we have the best healthcare, we think we have the best education, and you have a couple that works and they can't afford to fill their medication because it was outrageously priced. Avodril, Cetrotide, you see the huge discounts there, and the prices that we have previously listed are the lowest price that we could have found, last week. So we're very, very excited to release this information to our patients and to all the women and couples out there that are, purchasing this medication. It's going to make a difference, and it's really exciting.
So let me give you in a small phrase the take-home message. If a couple is undergoing an in vitro fertilization cycle, the cost of the medications will go from about $4,500 to $5,000 to about $1,800. That means about 60% discount in medication. That is a big deal. So we are super excited, letting everybody know that the medications are now affordable. We see, this is our daily practice. We see this as a daily problem. We deal with this every day, every hour. That's what we see. We are super excited that, we're gonna provide these little pills, these little pearls that will help people to access fertility care. We are also, in our minds, we are trying to push a foundation that will help people to get access to fertility care. We are just concentrated in devoting our time and our energy to help people to try to access fertility care.
So from today forward, really, for these medications, you should have this pricing. I've spoken to 2 pharmacies that confirm these prices. If you're not getting these prices, reach out. We'll help you find the right pharmacy. And we're excited. We're excited to share that information, and we're excited moving forward to share other updates and clinical information that's actually evidence-based. So, no miracle pills here. It's the truth. And that's what we want to deliver to you.
So please subscribe. Please share this information. We are really concentrated in trying to help people that have no access to fertility care. This is a big problem. We see it every day, and we're gonna try to help on doing that. So thank you for your time. Thank you for helping us. We are all on this. We're gonna try to solve this problem together.
And the more of us that join together, the more likely we'll solve the problem. It's nice to see you guys.
Thank you. Bye. See you next time.